Hi, I'm Jeannie Foley, and I'm here today with Dr. Pavato from the Florence Wormald Heart and Vascular Institute at St. Elizabeth. We're going to talk today about something called the metabolic syndrome. So, welcome. I'm glad that you joined us today.
Thank you very much. Thanks for having me.
I don't know a whole lot about the metabolic syndrome. Can you explain to me exactly what that is?
Yes. It's a good question, and it's an important one because it is becoming more and more prevalent within our population as obesity is on the rise exponentially so. So metabolic syndrome is essentially a set of 5 conditions that increase your risk for cardiovascular disease.
So you mentioned 5 things. Can you talk a little more about what those 5 things are that make up the disease?
Yes, so metabolic syndrome is diagnosed after meeting specific criteria. So one of them is large waist circumference, so that's 35 inches in women, 40 in men. High blood pressure, defined as top numbers we call systolic greater than 130, diastolic, which is the bottom number, greater than 85. High triglycerides, greater than 150 is the cutoff there. High blood sugar, greater than 100, and low HDL, which is your good cholesterol, less than 40.
So does lifestyle modification then decrease your risk for this syndrome, the metabolic syndrome, like it does other heart disease?
Absolutely, 100%. Over 90% of cardiovascular disease is preventable. Now, we can't change our genetics. Genetics do play a huge role in things like even elevated blood pressure and certainly our cholesterol profile. However, a huge majority of what we can do to prevent heart disease comes with us every single day. So that's eating a heart-healthy diet, exercising, reducing our stress as much as we can, taking care of ourselves on a daily basis will absolutely reduce your risk of this syndrome.
So if I'm diagnosed with metabolic syndrome, are there questions that I should ask my physician?
Absolutely. You could ask your physician, what are reliable professional resources I could look into about metabolic syndrome? And I would also ask your physician, am I at risk or do I have heart disease? Even in an asymptomatic patient, we can get something like a calcium score that lets us know if there's plaque buildup in your vessels. So those are the most important questions I think you should ask your physician with this condition.
Well, thank you so much for your time. This was very helpful. I myself didn't know a lot about metabolic syndrome, so now I feel like I can be on the lookout if I'm starting to have some of those risk factors and manage those through my lifestyle modification.
Absolutely.
If you, like myself, would like to learn more about the metabolic syndrome, visit our website,